Our next presenter is David Wright from the Department of History and Classical Studies at McGill University. David is a professor of history in Canada Research Chair in History of Health Policy at McGill. A specialist in the social history of modern medicine, he has published extensively on the history of psychiatry, children's health and disability, the development of hospitals, medical migration, and the evolution of Canadian Medicare.
Good morning, everyone. Thank you for joining me. I'm delighted again to be elected Fellow of the Royal Society of Canada. I'm deeply honored, and I very much appreciated the reception last night for the inductees. I'm going to speak to you this morning very briefly about my research, introduce myself, and then talk about one moment in the history of medicine that I think is particularly resonant in the current times, and that is the Spanish flu of 1918. But first, one or two things about myself. I'm trained as a social historian of medicine in the 19th and 20th centuries. I'm a historian by training. I'm not clinically trained, although I'm married to a clinician. My training occurred at McGill and at the University of Oxford, where there was a very well-known unit for the history of medicine called the Wellcome Unit for the History of Medicine, funded by the Wellcome Trust. And this was a research unit that fostered new interdisciplinary perspectives on the history of public health and disease, not only in Britain, but topics around the world. And I became deeply fascinated by this as a topic of research, how one could understand the history of medicine from sort of social or cultural perspectives. And in my case, I was particularly drawn to quantitative approaches, looking at patient records in the past. More recently, I've become interested in oral history itself, and this has led to publications such as work on the history of suicide, on the history of Down syndrome, on the history of pediatrics, and most recently with my colleague Sasha Mullally, a book on the history of Canadian Medicare. But today I thought, instead of talking about those, I would actually put forth a few ideas about why we keep hearing about the 1918 flu pandemic. Now, the flu, as Alfred Crosby famously described it in his book on the American experience, was really a book about forgetting. Why have we forgotten the great Spanish flu? And for most of the 20th century, this was true. North American society, Canadian and Americans, had focused on remembering the Great War, on establishing remembrance days, on monuments, of recognizing the fallen. And these were narratives in Canada, particularly very much about nation building, about battles such as Vimy Ridge, about masculine conceptions of sacrifice. Very much the Spanish flu, which happened at the end of the war, was something that society wanted to forget. Now, this changed very much just after 2000, one could argue, or by the late 1990s, when a series of global pandemics sort of shook, I think, the confidence of society and the medical profession itself. One could say that the antecedents to this was the emergence of the terrible AIDS pandemic, which hit its peak in Canada in the mid-1990s, but also the 2003 SARS, as well as H1N1 in 2009. This led to all sorts of retrospectives of the Spanish flu, a sort of re-remembering or rediscovering of the Spanish flu. And suddenly over time, everyone saw the Spanish flu as the sort of paradigmatic global pandemic. And we were sort of on watch to see when this would occur. And this became so dominant in the culture that all of the cultural references almost were about 1918, to the point that I was once watching Sanjay Gupta, the CNN medical correspondent, say this is the current COVID crisis is so much like 1918, it's creepy. That's a direct quote, which I thought was rather interesting. Now, of course, the parallels are quite striking. In 1918, there was the closure of schools, the restriction on public gatherings, wearing of face masks, field hospitals, even the cancellation of the Stanley Cup. And yet, at the same time, we see parallels to sort of social or public resistance, people refusing to wear masks, a lot of conspiracy theories about where the Spanish flu had actually come from. And this sort of gave rise to sort of 1918 as creating a lesson that we need to learn. The lessons were about so-called non-pharmaceutical interventions, or NPIs, the idea that 1918 sort of pioneered the characteristic of social distancing as a public health measure, and that there were sort of not just sort of social measures, but also sort of scientific lessons. There were actually mathematical epidemiologists who went back and looked at the data from 1918 and said, here are sort of scientific lessons that we can learn from mortality data at the time. And this led, of course, to lockdown strategies and a sort of sense of 1918 not just being a sort of historical lesson, but in fact being a scientific fact. Now, as historians, we, of course, are both sort of excited and somewhat ambivalent about when popular culture and scientists look back upon historical events and take an interest in them. We are historians, after all, but there were so many differences in 1918. We, of course, were at the end of a total war. The mortality regime was very different. The pandemic itself petered out with no real vaccine, and the restrictive measures that were put in place, a closure of schools, et cetera, lasted actually for a very short period of time, unlike in 2020. And perhaps most importantly, there was no testing or tracing at all. So this leads to a sort of general set of rhetorical questions, which I'll leave you with this morning. And that is, why do we look back on events such as 1918? Is it that we find comfort in the fact that previous generations had to go through what we did? Is it a sense that, in fact, maybe previous generations had it worse than we did? Or is there a sense of somehow history could be instrumental in teaching us a way forward? I hope, as many historians do, that people do take an interest in the past and explore the past, but understand it on its own terms and not as some sort of functional way of providing guidance for current public health authorities. Thank you very much for listening to me this morning.